Hey everyone, happy Friday. Welcome back to another live stream. Today we're going to talk about lots of different stuff. I already see questions coming in. We're going to talk about things like ebooks, exams, credentials. Oh my gosh, there's some stuff going on, some announcements. And yeah, I'm excited to be here. It's a great Friday. My throat's a little dry. I just ate a bite of a biscuit. I work in a co-working space and there's sometimes goodies here. But I am so happy to be back with all of you guys. Let me know in the chat what you guys want to talk about today. But also, don't forget to say hello to your friends in the chat, and we're going to get ready for today's live stream. Whoa! Hey, everyone, welcome back to another live stream. Hello to Nikki Saunders. Hello to Julia. And hello to all of our other friends joining from us across LinkedIn, across Facebook, across YouTube, Contempo Coding YouTube channel, up to 109,000 subscribers these days. Very excited for that. Um, I saw some questions coming in about Practicode, and so I want to a little bit start there today because I had actually someone recently ask on TikTok about internships, right? And the question was kind of interesting because it was, hey, my school that I went to that I picked said specifically, they said they specifically went to this school because they have an internship with the AAPC. And that kind of triggered this little thought in me. I'm like, I'm wondering if they don't actually mean an internship with the AAPC because that's not something I've heard in the past. Typically, you don't get to intern with the AAPC. I have a feeling that they meant that it includes the Practicode from the AAPC. So there's a difference between an internship and a practice. Now, both of those things can help you remove your apprenticeship status, but there is a difference between the on-site experience versus the Practicode. And this question even just came in from James Murphy. I see on the AAPC website that a CPCA Practicode module is offered. How helpful is this and would you recommend it? So there's two schools of thoughts here. We have to think about actual real life experience in medical coding and then the Practicode. Practicode is helpful, but it doesn't count as hands-on experience. What Practicode is, and I can check if I still have access to some of my modules. I don't think I do. But what I can show you is I do have a video that shows not what's in Practicode, but kind of like the input section that you have in Practicode, because obviously I wouldn't want to show the cases that are in Practicode, um, because that's these stuff. But I do have a video on the channel where I talk about Practicode so you can kind of visualize what it is. But essentially, Practicode is their redacted medical cases, right? And the APC just wants you to code them. It's not like the exam where the exams are multiple choice and you're selecting A, B, C, and D. Practicode is here's some boxes for the CPT codes, here's some boxes for the ICD-10-CM codes, the modifiers, which gets attached to which. And they don't tell you how many codes you're supposed to put on. They don't tell you what order you should be putting them in. They are literally just blank boxes that you fill in to code these cases. What Practicode does is it can take a year off of your apprenticeship status. Let me show you guys quick in the channel where I have a video that talks about Practicode. Let's get into videos. So your screen might look a little bit different when you're looking at the channel versus my screen. Camera second. Okay, there we go. So one of the cool things about the channel that I think not everyone might know, and sometimes it's harder to find it than it used to be. But if you're ever looking and going, oh, I wonder if Victoria has a video specifically on a certain subject. Ugh, my YouTube has been like freezing up on me for some reason lately. If you're ever wondering if you have a video on a specific subject, if you scroll over here, It used to be easier to see. Oh, see, there it goes. There is a little search button here with this magnifier. So if we're looking for a video on Practicode, it will help us search specifically the Contempo coding channel for that. Let's see if I can bring up a little bit of a snippet so you can kind of see what I'm talking about with the cases. Yeah. So Practicode is really just kind of a module. I have a lot of video analytical stuff that comes up on my on my side that you guys don't have. There we go. So yeah, it just provides you these boxes and you just put the codes into the boxes. So there's no multiple choice. It's literally just code these cases. So it's good for your apprenticeship removal, but most employers will not count that as actual on the job experience. When we talk about your apprenticeship removal, so there's different ways to get your apprenticeship status removed as a CPC. You can submit them in advance if you don't ever want to have to deal with being a CPCA. But if you don't submit that information, by default, you're going to be assigned an apprentice coder, and there's ways to remove that apprenticeship status. If you go onto the AAPC website, they do detail some of those steps that you have to take in order to remove your apprentice status. Yep, that Wikipedia. So, in order to remove your apprentice status as a CPC, if you're a CPCA, the apprentice status only exists for the CPC credential and the COC credential. There has been some discussion. I know, like last year at Healthcon, Bevan Erickson said, hey, we might at some point get rid of the apprenticeship status by having some other modules or training that you can do in lieu of that. I don't think they're there yet. And it's one of those things that it might take more time than they intend. So when it happens, it'll happen. But as it stands now, the CPC and the COC, you have an apprenticeship status for if you don't have 2 years of experience. So one of the ways that you can get rid of the apprentice is having 2 years experience. If you don't want to wait that long, there are things you can do that will each remove 1 year of that experience. So if you went to a AAPC approved program, an AAPC instructor, or any college where they can produce for you on their letterhead a statement saying, hey, I had 80 contact hours of medical coding education. It doesn't necessarily have to be through the AAPC. They're probably a more seamless process if you do go through the AAPC or an AAPC instructor. But if you can get something from your business school even that says, hey, they had 80 contact hours. It has to have the amount of hours, not just that a certificate of a completion, but the 80 hours on there. That can help remove 1 year of that 2 year experience requirement. The other thing that removes 1 year of the 2 year experience requirement is that Practicode. It is, from what I understand, quite grueling because, again, there's not a lot of support for it. It's not the A, B, C, or D, and they give you rationale. It really is very hands-on coding cases, so transitioning to that can be tough. Where it does become a benefit, though, is there are certain recruiters out there that maybe don't know all of the intense ins and outs of medical coding, but they know they were told not to hire CPCAs. So if you are applying for jobs and you see those ones that say no CPCAs, well, you might now, as someone who has removed their apprenticeship status, be able to apply for those positions. Um, if you see, though, a position that says they require 2 years experience, will the Practicode count as years of experience? No, it won't count for that. Give me 1 second. I'm just going to move over here. How do I want to do this? Let's see. We'll switch over. Here we go. All right. So that's kind of the difference between the experience and the Practicode. The Practicode isn't necessarily it's a good thing because you can help expedite removing your apprenticeship status. And some people, they just don't like being considered an apprentice coder, so they want to do it just for that purpose. But it does not count as on the job experience. It doesn't count as an actual internship. If you are looking for a program, though, that does offer an internship, I do have a partnership with Preppy. So excuse me, Preppy is a medical billing and coding course that is on demand. You take it at your own pace, and they do offer books included. They will send the ebooks, and we are pushing a lot more towards those ebooks these days. They do offer the ebooks. You can, at the end of the course, purchase the paper books if you would like the paper books. And then they do offer an internship program, and you get a certificate from basically Auburn College. So you get like a college certificate of completion. It's a really great program if you're interested in that, or you're interested more in a career in medical billing and coding. Check out medicalcodingmasterclass.com. That is the information that I put together with those individuals. And full disclosure, they are a sponsor of the channel, so I do receive a small commission for anyone that enrolls in that program. Did I attend Healthcon this year? Okay, let's talk about this. So, I love going to Healthcon. I think these conventions are great. But kind of weighing a few things. First off, I have had no desire ever to really go to Nashville. I'm sorry. It's just not uh it's just not my thing. I mean, I love people that wanted to go there. Cool. Like I was just not super interested in that location. Um and At this point, like, I was kind of looking at it and going, "Okay, well, what's my ROI of going to HealthCon? I mean, I'm gonna get some education. Is it education I couldn't get elsewhere? Do I need the CEUs? Eh. I'm not gonna get additional subscribers. I'm not gonna probably get people to sign up for my courses because the people that are gonna be at HealthCon already know who I am and what I do and what I offer. I didn't think it was gonna lead to additional partnerships, so I'm kind of like, I just didn't I just I'm sure and I don't doubt that it was a great time. I just personally did not want to spend the money to go there. I will be at regionals. I did register today for regionals, so I will be at DC this year. Planning some things for when I go to DC. Yeah. Yeah, and Pam, yeah, next year is Vegas, which Vegas is like okay, but I've kind of like I don't know. I've been there. I was there once a few years ago for HealthCon, and I'm sure there's lots of cool stuff to do, but it's not. mm, Leah is asking, what is prophy? I used to work at urgent care and I built for pediatrics, but I've never heard that word before. Ooh, let me see if I can bring up my slides that I had. So there's different types of medical coding, right? There's professional fee, there's inpatient, there is outpatient, and there is risk adjustment as well. Um, Let me see if I can find my slides. But essentially, when you hear pro fee, that means professional based services or provider based services, billing for those services that are rendered by physicians, nurse practitioners, physician assistants, midwives, etc. Billing for their services, the office visits, the surgeries, the procedures, services, injections provided by providers versus inpatient coding, which is that reimbursement that goes to the hospital. That's the stuff that we often bill out on the UBO4 form, things that involve like ICD-10 PCS coding. So when we talk about pro fee coding, it's that money is going in the pockets of the providers or the providers organization. In inpatient coding, that money is going to the hospital or the facility. Outpatient coding is billing for outpatient facility services, so things that are rendered in um, surgery centers or ambulatory surgical centers or some of those clinics that maybe are owned by the hospital that they look and smell and feel like a doctor's office, but they're actually considered part of the facility, so they're not inpatient admits, they're outpatient facility. And then, of course, risk adjustment coding, which is just based off of ICD-10 CM, and we are reimbursed based off of factors like the diseases that the patient has, the more costly diseases that the patient has, or conditions that that patient has, and doing various things to try and keep costs down for those patients that are expected to have a higher cost associated to them. Can I do more E&M exercise videos? I can. I don't know if I'm going to have that in the plan. So I'm going to be gone like the second half of June on vacation. So I'm planning out the next like several weeks worth of content to be scheduled so that it can publish while I'm out in June. And right now I have a couple of things that I need to cover some urgent stuff going on in the industry that I'm like, "Ooh, let's talk about this." And yeah, so yeah, but I do wanna do more E&M courses. If you need E&M education though, I'm gonna tell you, like, especially with the way that this industry is going, look into getting more affiliated with NAMUS. NAMUS is the National Alliance of Medical Auditing Specialists, and they are phenomenal. They have lots of great evaluation and management training and workshops, references, and I think as we see medical coding starting to transition and us shifting more towards using electronic tools like our ebooks, like our encoders, and seeing more things where there's going to be some automation of medical coding, and we're going to have to transition our roles to more clinical documentation improvement, to more auditing, to more evaluating coding for not maybe every case, but those high dollar cases or certain ones that look like they need some more attention, focusing different efforts onto auditing. You definitely want to start getting aligned with NAMUS. I mean, and their education is like it's superb, it's sublime. I'm already registered for, the NAMUS conference for December, so you're definitely gonna see me there. I believe they are in Charleston, South Carolina, but yeah, they have amazing stuff. I've got my NAMUS audit grids, like, at the ready at all. They're amazing. Heidi, what are some good entry-level jobs to pursue while I am studying? Ooh. Anything where you can really get your foot into the door in medical coding. I know a lot of people will ask me, like, are there jobs out there that will help train me in medical coding while I'm still a student? There are. Are they easy to find and ample? Maybe not so much. I mean, I've worked in the past with like Penn State Health and we would sometimes hire coders that we knew were in the middle of their program and seemed smart enough that they were probably going to be a good fit for the team. They were probably going to pass their exam and say, hey, you know what? We just are going to make it contingent that within 1 year of your date of hire, you have to have your CPC. So there are some out there. They're harder to find. When I was a supervisor at Lancaster General Health, we made sure that we had at least a few entry level positions that we would bring people in that were more like a medical coding assistant, I guess. And they would do things like review edits in the system. Oh, check and see if this needs a 25 modifier. And oh, okay. And they'd put on the 25 modifier, or things that we knew maybe providers had a higher risk of maybe not picking the right codes for, and they'd kind of review those little cases to start getting them acclimated to what they will see when they transition to a coder or eventually an education or auditor. So those positions, they're out there. They might not necessarily have some in your region, but they are out there. As far as finding medical coding jobs, there's a couple of good places you can check. What I would recommend if you're not a CPC yet, go in there and look at things like type in like ICD-10 CM. Oop, EMN. We don't want that. CM. And what it'll do is it'll bring up all of the jobs that are looking for a skill set in ICD-10 CM. Some of them might be coding, some of them might not. Maybe they were in the billing department. Maybe there's someone who does prior authorizations. But look for those kind of positions, and that will start getting you familiar with not only some of the codes, but some of the systems that that healthcare organization is using, some of the people that are working in that healthcare organization. You can start making those connections to go, hey, I do this, but I really want to get into medical coding. Start networking with your local chapter too. Like that's really, really important is getting onto those local chapter meetings. Oftentimes, these local chapters at the very first few minutes of their meetings will say, hey, they go over the chapter business. Here's some promotions that the APC is having. They'll introduce themselves, I'm the president, I'm the vice president, etc. And then oftentimes they'll go into, hey, here's some job openings that we're aware of. CSI is hiring or Optum is hiring. The judge group is hiring whoever, and they'll announce who's hiring, and they'll ask of their members if they know of any job openings or job openings that are upcoming in their organizations as well. Is there a way to get this anatomy and physiology to stick? I'm really struggling. Do you suggest some websites or practice sites? Yeah. Here's what I'll tell you. And I think there's a really good book that can help out specifically with the medical coding side. Um, Medical terminology for coding. That is a great book. If you are into videos, you can check Crash Course. They have some cute videos um, on anatomy and physiology. Yeah, here we go. Right here on YouTube, Anatomy and Physiology. It's by Hank. And I don't know if you guys have heard the news. Hank, who's very popular for doing so much science and goodness and wonderful information across various social media platforms, including this crash course, was recently diagnosed with Hodgkin's lymphoma and has started chemotherapy. But Hank does an amazing job bring down the different concepts of anatomy and physiology. So I really enjoy that series. All right. What would you consider step one for someone with zero knowledge in coding to get started? There's a couple of things I want you to do. You can check out codingmasterclass.com because that's the masterclass that I put together, career masterclass that I put together for all the information about medical coding, and then gives you my best recommendation of what program to get into. The other thing you can do is I also have a playlist in medical coding. So let's get back here on the channel. So I get that asked so much that I thought it would be a good idea to just build a playlist for like the I'm new to medical coding and I need help. Where do I start? Oh, here we go. Want to become a medical coder? Start here. So that's my playlist that I put together for the people who have zero knowledge. You're just looking into this career, finding out what it's all about. You can start there. And I do also have, if you're ever interested, a video on self study options. This is the older one. I do have a newer one available. Let's see here. Self study, paper, ebooks, billing, inside coding. Let's see if I can find it. There's a new self study book, self study video where I talk about if you're interested in, yeah, here we go, the self study video um, on what tools you can use if you want to study medical coding for yourself at home, tools, things that maybe you even want to use to supplement some courses that you might be in right now. That's a great resource to use. Oh, yeah. So I did talk about this, I think, a little bit on the last live. So there was an article that was posted by the AMA saying that there is a 30% shortage in medical coders. And they said this is based off of various studies. So of course I scrolled to the bottom of the article looking for the citations of what these studies are and didn't find anything. And I've searched around and not found anything referencing these studies. I found no studies about a shortage in medical coders. So I am a little concerned that these studies might not be out there, or they might not really necessarily be studies as far as something that was scientifically formally put together, as much as just people saying that they're out there, people, certain pockets of areas maybe saying that they're having problems finding coders. Honestly, and this is just my independent opinion, I don't think there is necessarily a shortage of coders, but I think there are a lot of positions that are looking for very specific types of coders and that are having difficulty finding that. Like someone who maybe is in a neurology practice and they're looking for someone that has 5 years of neurology coding experience. I think we have a lot more of that than we do just general shortage of coders. And I do agree with what the AMA had kind of a little bit put into their article because they were promoting how certain organizations have developed programs where they will bring people in and provide them more of that specialized training that's targeted to those openings that they have. And I think that is genuinely an area where we are lacking in this industry. And it's very unfortunate because, we have to have a next generation of coders. Those of us that have been in this industry for 15, 20 years are going to retire at some point, and we have to have a new batch of coders in that know all of this stuff. We can't just like gatekeep all of this material from everyone. So, yeah, I definitely agree that that is something that needs to be better focused on in this industry is allowing more structure for those entry level coding positions. Hey, we don't need to have our, $30 an hour coders doing things like looking at claim edits, but we would love someone that has some coding skills and has their CPC to come in and kind of look at maybe some claim edit stuff. Maybe get together some reports, start getting their foot in the door a little bit, and start getting um, you know, uh, getting their feet wet, I guess, with some of the different tasks in the coding department, and then have them progress up into the coder position where maybe they're coding surgeries, and then into maybe a team lead and supervisor if they would so desire. But I definitely think that's somewhere where we're kind of lacking is that progression within the industries because I think at least some of the organizations I've worked at, it feels like they're constantly putting out fires, putting out fires, putting out fires, and it's like, "Oh, we don't have time to train. Oh, we can't. We need someone who's gonna hit the ground running," because they're constantly in this state of just putting out fire after fire after fire after fire. What is a good place to get training and offers internship coding clarified? I would definitely recommend Preppy. You can find out more about them at preppy.org or by signing up for my free career masterclass at medicalcodingmasterclass.com. They have lots of organization. I'll even, I'm just going to even bring it up. They have lots of organizations that they do partner with for internships. And when I say internships, I mean like an actual internship because there are places that will offer like a mock internship where it's like, oh, you go through a module and it's like, okay, a patient comes in through the medical office and they need their flu shot and blah, blah, blah. And you just pick things in the module. Preppy actually does offer like proper internships. And I think they have, let's see if we have it in here. Okay. Courses. Gonna move over here. Courses. Wait. Ooh, medical billing and coding. There we go. So internships. Yeah, here we go. Yeah, externship. I'm sorry. I use internship and externship, I guess sometimes interchangeably. Um, but yeah, they have companies that they work with that they provide the externships for, and you get actual coding work experience, and they will help you set that up. And they provide a lot more support than I would. A lot of people ask me like, "Hey, oh, Victoria, why don't you just teach your own medical billing and coding program?" And I do have some for special certifications, for the auditing certification, for the risk adjustment certification. The risk adjustment one's great. And I do have reviews and things. But there is just such a volume of people that come to me and they're like, "Hey, can you teach me medical billing and coding?" And it's way too much for me to be able to handle. Okay, is this someone who just has a passing interest and is going to lose interest after a little while, and then they're going to start asking for refunds? Is this someone who has some experience and maybe I need to offer them this? Or, then of course, supporting all of those students with all the questions that they're going to have and tech issues. It would just be way, way more than I could handle without having to hire a huge team. And I am not a good manager. I am very flaky and flighty, and it's just not something that I would have a lot of interest in doing to build the team. And some people do that phenomenally. They want to build a team and an empire, and I'm not. I'm just like I just want to be Victoria. So I worked with Grant Aldrich, who runs Preppy, to find like the best in class programs out there and say, okay, this is the one that I can take all of the people who I know uh, are in my audience that want to get into this career, and I trust that this is going to be the best program to get them into. Can I go to Preppy for externship being after being enrolled in a different school? I don't believe they offer that. You can ask help at preppy.org, but my understanding is that's just offered to the Preppy students. I want to know before taking the CPC, do I need to go to an accredited school or take an accredited program in order to take the CPC, or will the CPC ask for proof of schooling? No. There is no such thing as a CPC accredited or AAPC accredited program. There is what you will find is there is AAPC approved instructors or AAPC approved curriculum, which means that they're essentially using the same curriculum as the AAPC. They licensed it off of them. They paid almost like oh, I can't think of the word right now, fees, almost like they franchise it off of the AAPC. So you will find schools even out there, colleges, independent instructors that have paid a licensing fee to the AAPC, and the AAPC has given them a big ol' file of all of their PowerPoints and training materials and exam banks and everything. So they're AAPC approved. It's the official curriculum. Um, but you don't need to do that to get the CPC. And I'll show you kind of some stuff on the CPC exam here. Excuse me. Technically, the only requirement in order to take the CPC exam is that you pay for the exam fee. That's really it. You're not going to do very well, obviously, if you haven't had some sort of formal training, but it doesn't need to be through any sort of special school or accredited school. You just need training. Let's see if I can find it here. Do. Certifications, view all certifications. Mm, Find the right certification. And then, of course, in order to take the exam, you also have to be a member of the AAPC. So you have to pay the exam fee and the membership fee. The membership fee is due every year. You cannot maintain certifications with the AAPC without being an AAPC member. So you do have to have membership dues paid every year, as well as continuing education credits that are due every other year. Although sometimes that changes depending on corporate registrations. If your employer puts you on a program where they pay for your membership dues, that might make it shorter or longer, or change the date, I guess, rather. um, so if we look at the website here, it says, do I need the prerequisites? And this is the prerequisites. Obviously you want to know medical terminology in order to do medical coding. And it says, if your education or employment background have prepared you with reliable knowledge of medical terminology, anatomy, and physiology, you can skip past the prerequisites. Otherwise, you should take this course as the CPC exam will thoroughly test you in your blah, 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 blah. But you don't have to go through an official course. Like I could probably go on right now and just schedule the CPC exam to take it tomorrow via the online proctor. I mean, I don't know if it would actually let me do that since I already have my CPC, but yeah, you don't have to. There's no accreditation process. There is for AHEMA. I think there might not for all of their credentials, but for a couple of the AHEMA credentials, there are certain prerequisites, like their RHIT, you have to go through an approved associate's degree program. The AAPC, basically, whenever you're ready, they're ready. To the best of my knowledge, they do, but I would ask help at preppy.org because they have the more specific details as far as the who, what, where's, when's, why, and how's of each state. So check with them. They should be able to help you out. The ASMR teacher saying, I suggest finding an office job at the doctor's office or hospital. That can be a great foot in the door. I was ER registration and was able to transfer to coding after I was certified. Yeah. I know it's so frustrating and it's so hard. And if I could snap my fingers and change it for you guys, I swear I would. I swear I would. But I know that like when you go to school and you train to be a medical coder, you want a medical coding job, right? Um, and some people can get into a medical coding job right away. Other people, they have to start maybe in the billing department or accounts receivable or doing something where they're dealing with the codes, but the job title might not necessarily be medical coder. And I know that's frustrating, but What do I think about utilizing the online test taking? You have to make sure that you have everything set up, that you've read through the instructions. I think the online remote proctor is fine. Some of the difficulties I've taken, because I did take it once for my family practice certification, some of the difficulties I found were um, because of the exam center being located in India. The person who was reading me the instructions had a very different accent than I did, and I had difficulty picking up some of the things that they were saying. But because I had read through the proctor instructions prior, I was able to pick it up better. I think if you're someone who doesn't handle different dialects or different accents well, that could be a little bit of a frustrating point. So make sure that you're reading through those instructions ahead of time so that you kind of have a feel for what's going on. And you do have to have things like if you were to see, let me see if I can even do this here. If you were to look at my desk now, I don't have anything incriminating on here. So my desk right here, right now, um, is a big old mess. I've got on. See if we can focus in. I've got 2 monitors here, which are not allowed for the exam. I've got I've got scissors on my desk. I've got eye drops on my desk because I still have to take those for another couple of weeks. I've got, remote controls for my different lights. Oh, I forgot to turn my lights on. How about that, you guys? There. I've got the remote control for lights. So when you're taking the online remote proctored exam, when you're taking the online remote proctored exam, can't have anything on your desk but your either computer and your keyboard or your laptop. If you have a second monitor, it has to be disconnected. They will have you go through your task menu and check what applications are running. So second monitors have to be disconnected. You can't have anything other than like your books, your federally issued ID, or state issued, I guess, ID, and a drink. So you're not allowed to have paper. You're not allowed to have pencils. Nothing like that is allowed. Um, and some people don't understand too that it has to be like an external camera because you have to be able to move it around and even show them like under your desk. I've actually had people make ask me to make a video demonstrating, and I will then um, the external camera and how they do the sweep because they do. They will ask you to take your camera and sweep even under your desk to make sure that you don't have recording devices under there. They'll want you to do a whole 360 of your room to make sure that you don't have cameras, other people in the room, etc. Because they it's a lot of work. It's a lot of work to put these tests together because it's not just one test. They have different variations of them. They have a huge test bank full of questions that they pull um, the different exams from. So if that's compromised, well, now we have to throw out all those exam questions, create new exam questions. So they want to really protect the integrity of the exam and by extension protect the integrity of us as coders so that everyone in the industry has faith that we have passed this exam through proper means and not through inappropriate means, right? Um, so, as far as, questions like Renee has, can you take the AEPC certification exam on your kitchen table? That really depends on the way your kitchen table is set up because they have regulations about no one else can be coming into that room. They'll shut your exam straight down. You can't have it can't even like look like you would have recording devices or something. I took mine in a conference room. Um, and yeah, so they're very strict about what is and isn't permitted. But I would contact the AEPC directly if you have questions about like, can I have a bookshelf in my room? Can I have this? Can I have that? Because I don't want to go down the path of, oh yeah, you're permitted to have this, and then someone says, oh, no, I wasn't allowed to. So go with the AEPC, all the information that they send you, read through it very, very carefully. Um, as far as exams, we just passed Healthcon, and Bevan Erickson was talking about how we are um, going to see a switch to exam centers starting in 2024. So currently, from 2023 and all the years prior, you could take your exam at a physical location at a local chapter. So the problem that we ran into, especially over the pandemic, is that local chapters had trouble finding locations. A lot of them were borrowing them from hospitals and schools. Well, what shut down during the pandemic? Hospitals and schools. Like they didn't want outsiders coming in that may be spreading germs and sicknesses and so forth. So they put a lot of restrictions on who was able to come in and out. So they weren't eager to loan out their conference spaces and so forth. So um, there are oh, sorry, I just got sidetracked. Oh, so because there was just such issues finding locations, chapters were saying, we can't find anywhere. They had to rent spaces maybe from hotels, and then they were depleting all of their chapter funds. They're starting to move towards these exam centers. Now, one of the things that I will say, as far as the CPC exam, so starting next year, they're going to start doing exam centers. Now, I've heard a lot of people saying you can't take, oh, I heard from my instructor that you can't take in person exams anymore, that this is the last year that we're having in person exams. Not quite right. I think it might be the last year that we're going to have physical paper exams that let you fill in a bubble sheet. Because the way Bevan made it sound from HealthCon is that um, the exam centers will require a certain amount of technology and computers, and local chapters don't have that, which to me triggers in my mind, oh, well, that means you're going to be taking it at the exam center on a computer, not on a paper exam grid. Um, so there may be the elimination of the paper exam, but there will still be in-person exams. They'll just be at the exam centers. See if I can find. Yeah. So I thought personally that they would go through Pearson because that's where HEMA goes through. But let's take a look. Victoria and her sleuthing. Um, the place that they're currently working with for the online proctors is Measure Learning. And if you go online and Google Measure Learning, they do have exam centers. So I don't think they've officially announced, but that would be my guess is where they are going. Let's see, test center exam proctoring. So that's where my best guess. Again, I'm not going to say this is what they're doing, but my guess is that's where they're going to be having these exam centers, and you'll be taking them on the computer versus taking them on a paper bubble grid. Um, yeah, which as far as is that going to change the difficulty level of the exam? I don't think the questions are gonna be any harder or easier. It might change your personal preferences if you're someone who still likes, the paper and being able to physically bubble in everything. You might personally find it more difficult to do something on the computer. But what we've been hearing a lot more though from the AEPC is that the people who have been taking the training online are more accustomed to doing the questions and answers online, and then they are more successful in the online exams. Um, yeah, and that is a consideration. It can be sometimes harder to go back and forth depending on what you're doing, and again, and everyone has different taste preferences. Um, one of the one of the situations that I ran into when I was taking the online remote proctored exam is, remember how I said you can't take any like scrap paper, pencils, anything like that. So you can't like write in your book, you can't do any of that. One of the problems I ran into is I kept losing my page because I didn't have like a piece of paper or a pencil or anything to like take and stick in my book to mark a page. So I had an extra little tab in my book. You're not allowed to use sticky notes as tabs, but you can add extra tabs if you want. I had a little extra tab that had nothing on it that I just stuck in my book. And then if I needed to save my page, I would just take that blank tab and put it where I needed to flip back and forth from. Um, and yeah. So for the exams, the books, they're looking, I think, into doing ebooks with the exams in the future as well. I'm not 100% clear, and if anyone knows, definitely let me know. Um, on if they are going to have blank ebooks embedded in the exam, or they are going to require you to log into your bookshelf app and use your own. Because there's a little bit of a difference between that, because if you log into your own, you can you can make your own notes, you can do your own highlighting, and that's what we've been historically used to in the past, being able to have our own notes and highlighting and stuff in the books. Because if I'm looking at just a default one that it's just like a blank book that I get in there, that's a little bit different than using my bookshelf app. And I pre-ordered. I don't know about you guys, but when they were like, "Yeah, we'll give you the paper books and then include all of the ebooks for like under $300." They were having that special last month. Boy, did I jump on that. So my 2024 books are like already I'm ready to go. Um, but so one of the things I want to show you guys is, let's see if this is here from my video yesterday. Um, so you can highlight, you can notate your books in the application. I think I had put something here about prolonged care or something. Let's see if I can find it. I'm gonna have to get a little bit better at navigating through the ebooks. I feel like I had something in here for prolonged care. There it is. Okay. So like here, I can write myself a little note here that like Medicare has a G code that they use for these prolonged care services. So that's going to be beneficial if they'll let students log in to see all their own notes. But where that runs into problems though is, and I can't remember off the top of my head where this is, but there is, I don't want to show anyone all of the stuff in my book. Hold on one second. See if I can find it. My account. No. Let's see if I can find it here. I'm looking around in my books. Excuse me, but yeah, I think a lot of us are going to have to start getting more familiar with how to navigate through the ebooks. And to Bevan's point, at Healthcon, a lot of employers now with these remote employees all across the country, like they don't want to have to ship out books all over the place, because that's either going to be they're going to have to send it to one headquarters, and that headquarters is going to have to ship it out to 50 different coders, or they're going to have a vendor shipping out to 50 different coders, and that gets very expensive with just shipping fees, and then environmentally that takes a toll on things. Oh gosh, let's see if I could find it. Where is it? I know there's a tool in here to let you do the stuff. Hold on, I'm gonna find it. It kills me. Beta features. No. Single and double page two emoji reacts. Maybe it's at the very bottom. In any case, I know there is a way in the application somewhere. I can't find it right now. Oh, there we go. Of course, it's the icon that I didn't click. There is a way to do that. I don't want you can export your notes. That's not what I wanted to do though. There is a way to share your notes. Annotations, my bookmarks. Where is it? Highlight notes, add or edit highlights. Okay. I can't find it right now, but I swear there is a way that you can share your notes with other people, that you basically give them a link and it will copy all of the notes that you've written in your book to their book, which I think then has perhaps some security concerns there. Because let's say I take the CPC exam and then right afterwards I go, okay, what's all the questions I can remember? And I'm going to notate them in my book somewhere. And then I just share all of my notes from my book, to everyone. That could be a little problematic. So I'm curious to see if we're still going to allow you log on to your copy of the book with all of your notes and your highlights, or the APC embeds a book that is a blank version of the book that's like, I guess, shared between everyone or what have you. So it'll be interesting to see. Yeah. Not be able to use notes during the test. Yeah. Yeah. I'm waiting to see what they're gonna say from like I'm sure it's when they kind of start getting closer to the transition, there'll be social hours and so forth with AAPC Alex. Yeah. I'm trying to keep abreast of all of the developments going on with the exams. Yeah, I know. It's just, it's tough too with these notes because you have to like almost Google how to make the notes or be a little bit savvy or click on things versus like if I know I want to write a note in my book, I just take the pen and boop, put in the note right here. So it's definitely a learning curve, that's for sure. Yep. My mouse is clicking out on me. See, that's what I'm saying, Sandra. That's what I'm waiting for. I'm waiting for us to get to the point where whatever I notate in my 2023 book will automatically transfer over into my book for 2024. That's what I want to see. I've been waiting for that technology for years. Give me one second. My mouse is hooked up through a USB hub, and sometimes my hub likes to give me issues. Or my mouse is out of battery, I'm not sure. Oh, it's not glowing, so I think it might be out of battery. Hold on. That's a whole other issue. There we go. Okay. Oh, good. I can't wait for that. Like, I'm jazzed. Like, I just want oh, see that maybe then I should have gone to health. Well, I guess I'll be there and I'll be at regional in DC if they have the same info booth there, I can go and pry questions. Although I do know they are having I've been trying to get the registration form. They're having a seminar in Philadelphia that I wanna go to, and I know Alex is gonna be there. Um, but yeah, I will be at DC for sure. I just submitted my registration, this morning. Yeah, Heather, something other than coding to gain experience, you could try payment posting, you could try, accounts receivable, prior authorization. You can go even into, I think, LinkedIn. I think LinkedIn has the searches for jobs as well. Yeah, so even if you go on like LinkedIn and want to do jobs, and then it says you can search by title or skill, search by ICD 10 CM, and then find all of the jobs that you can find in ICD that want a skill set of ICD 10 CM, and it'll pull all of those in. Some of them may or may not be medical coding jobs, but they will be looking for those coding skill sets. Come on now, what the heck is going on with my internet? Oh, maybe it's because I didn't put a location in. That was user error. And you can even do this for, I know LinkedIn you can do it, Indeed you can do it, and Google you can do it. Check the entry level. Now that depends on if they were put incorrectly. When in Philly? When in Philly? Oop, too many comments coming in. When in Philly? Next month. It's literally the day before I leave for my next Disney trip. It is. Let's see. Hold on. Resources. Oh, so this is the funniest thing. For some reason, I've not been getting my notifications for all of my subscribed to chapters uh, for the past, oh my gosh, through all of 2023 at least. So I was just like peeking around, looking at what's going on for like May Mania, and of course, all the May Manias around me were like booked when my kid had a birthday party or go to go to, and I wasn't able to attend. But I did find 'Cause again, I'm not getting my emails for whatever reason. I don't know why. I've checked my account. They're set up correctly. They're just not there. But the Philadelphia chapter has got a spring symposium coming up June 16th. So I'm hoping to make it out for that. And a recruiter database. That would be a good idea, John. Who to connect to. Oh my gosh, could you imagine? I always I always laugh a little when recruiters are like, "Yeah, you can help me find people. We'll help promote on your website." And I'm like, "Do you know how many people you're gonna get if I say, 'Hey, you've got a coding position open?' Like, thousands." Um, yeah, I want them to come back to Disney. That's what I want. I want that in my life. I need that in my life. But I'm gonna go to Disney anyway. It's just that it would be great to hang out with everyone while I'm there. I could show everyone all the ropes, of the good rides and snacks and stuff that I like. Yeah. I know the next one's at we're next health big health con is in Vegas. I know they're contracted right now with the Gaylord hotels, but there is a very nice Gaylord in Orlando, from what I understand. Um, yeah, Code Health, I think they're retooling a lot of stuff that doesn't involve need of promotion with me right now. So check with info@codehealth.com. That's their email. I know they have been working on revamping some of their assessments and balancing out some of the coders that they have dedicated to certain projects or providers right now. Other than that, I don't have too much. Other than I know they are a legit company because I do vet companies before I start doing any work with them. Can I tell you what the final exam of the CPC exam course is like? The final exam, like the not the certification part, but like when you're going through your course and your final exam. It's basically, randomized questions from all the different sections. As far as I mean, I would think it's probably gonna follow like the actual certification exam does. The certification exam does follow kind of a structure. Let's see here. Yeah, I haven't so I'm not sure anymore if the final exam for the CPC course is like 100 questions or if it's down to 50 or a smaller one. But if we go onto the AAPC website, they do have a breakdown of what's on the exam. See if I can find it. Mhm. Prepare for the exam. No, it's not that one. I'm telling you, ever since they redid the website, taking the exam. There it is. Yes, yes. Okay, there it is. It's under taking the exam. Breakdown of the 100 question CPC exam. 4 med term, 4 anatomy, 3 compliance and regulatory, 7 coding guidelines, 5 ICD-10 CM, 3 HIC picks, and then each of the different series usually have 6 questions. So 6 questions from 10, 20, 30, 40, 50,000 series, 60,000 series, 6 from radiology, 6 from path and lab, 6 medicine, 6 E&M, 4 anesthesia, and then 10 cases, 1 question each. So the cases are basically like they give you a note and then they'll ask you a question based off of the whole note. Um, there are other certifications where they have questions as well, but sometimes they'll ask you like 2 or 3 or 4 questions on the same case, like what are the ICD-10 CM codes, or if you were going to educate a provider on this note, what tips would you give them? But for the CPC exam, at least that's what they have on the website as far as what's on it. Each case they will have one question and is going to, probably be what's the ICD-10 CM, CPT, and HCPCS codes for this. Um, do you have to take a course or can you just take the exam? Yeah, you absolutely can take the exam. I mean, of course, if you don't have training in medical coding, you might not do as well. If you've been doing this on the job or something and you think you have a good chance of passing it, yeah, that's you can just go ahead and take the exam. I would recommend at least maybe trying a practice examination first just to verify that you're ready for the exam. But yeah, technically the only requirements to uh to take the exam are to pay the exam fee and be a member of the AAPC. Yeah, you know what? I've been getting a lot of questions lately from people, hey, can I work in Canada? Can I work in Australia? Can I do coding for Australia? Can I do coding for Canada? Can I do, the UK has come up a lot lately. Um, so the CPC certification is based off of three code sets: CPT, HCPCS, and ICD-10 CM. ICD-10 CM is the version that we use in the United States. So in Canada, they use ICD-10 CA, so they likely wouldn't take a CPC certification in Canada. And different countries use different variants of ICD-10 CM. So as far as if a CPC will be good in other countries, as far as work visas, as far as can you work in this country when you're located in this, yeah, that I'm not all terribly up to snuff with. Um, so we are at the hour. I will be back next. Oh no, I won't because I'm going to a comic book convention next week. So I won't be back next week. I should be back the week after. But this was a great conversation. And if you guys have any additional comments, feel free to leave them in the chat or on the YouTube channel. I will see you guys next time at the live stream. And until then, you guys just keep on coding on.